Hello and welcome to From the Heart. I'm a heart parent and your host, Sami Glastonbury. This episode will be a little bit different to our usual interview style today because I'm joined by Mel from HeartKids, who is going to chat with me about my life updates and being a heart parent, and also too a bit about what's going on in the HeartKids community and all the successes from this year. Well, I didn't think much of it at all, if I'm really honest, until actually the start of this year when she said, "Oh, Mum, I'm having one of those stitches again," and she came out into the kitchen and she was holding her heart. And that moment was, I'm not going to lie, Mel, it was hard. It was really, really hard because, yeah, she was holding her heart. She wasn't holding her lungs or diaphragm or anything lower. And so, of course, I think being in this world, I knew exactly when she was holding her heart, it was her heart. So that was really confronting for me. Before we begin, we would like to acknowledge the traditional owners of the lands on which we record. Today we are recording on country of the Kaurna people of the Adelaide Plains. We pay our respects to elders past and present who are a part of the world's oldest continuing culture and our first storytellers. We acknowledge the importance of supporting health for all peoples now and in the future. Aboriginal and Torres Strait Islander listeners should be aware that this podcast may contain images, voices and names of deceased persons. A very warm welcome to you, Mel. Thanks for joining me. It's lovely that you and I actually get to chat instead of just having you in the background. So where are you joining us from?
Thanks for having me, Sami. I'm coming to you from very windy Wurundjeri country in Melbourne.
Beautiful. And are we starting to warm up in Melbourne yet? We're not in Adelaide as yet, but what about over in Melbourne?
We're getting some hints of some warm weather, but I'm not sure I trust it just yet. Definitely still sitting here rugged up and hoping for some sunshine.
Completely understand. So Mel, talk us through what's been happening for HeartKids this year. It's looking like it's shaping up to be a massive year. So step us through. What's going on?
It has been such a huge year for HeartKids this year. Earlier this year, we had our interim CEO, Leslie Jordan, step down, and taking her place is Marcus Sandman, who is our current CEO. So that was a very big changeover, and we miss Leslie very much and wish her very well. And Marcus is just leading so many incredible initiatives at the moment. In February, we had our big childhood-onset heart disease standards of care launched in Parliament.
Yes, that was
at
huge.
Parliament House.
Absolutely huge.
It was such a huge event, and I was so honoured to be there on the day. I got to see Mark Butler speak about the standards of care with so much passion and so much importance. Lots of healthcare professionals there, people that you and I both met before, like Dr. Prem Venugopal was there, which was wonderful. And we also had some representatives from the COHD community as well. So really, really huge event. And it's great to see some forward action happening on implementing the standards of care over time as well.
That's really great to hear, Mel. That's great to hear that HeartKids is having that national presence where our voices and all this hard work were being seen and heard. I think that's so validating for our community and just so wonderful to hear. It was great to have, obviously lovely to hear that you were in the room, but all those really heavy hitters and those people that are working tirelessly every day behind the scenes to get the name of HeartKids Limited out there and the important work that we do. So that just warms my heart to know that on a federal level, those discussions are happening and all that hard work is coming to fruition. As you know, we started this journey, 6-7 years ago now as a federated model, a limited model, I should say. So that's so wonderful. So what else is happening in the other spaces?
So as part of some new initiatives, we have had a Reconciliation Action Plan Committee commence this year. It's currently underway, and we're really focusing on developing a reconciliation action plan that demonstrates our actions as an organisation, really in an ongoing commitment to reconciliation. And as we know, reconciliation is an ongoing journey. So there's lots of lessons for us to learn and lots of cultural capabilities to be built up, but we're really looking forward to how things are progressing in that committee.
Yeah, that's wonderful for here, and that's beautiful for that. We have an extended community, obviously, out in different parts of regional and rural Australia. And as we've spoken about on the podcast before, that RHD community, it's great to see that we're really bridging those gaps and doing our piece towards reconciliation.
Absolutely. And then, apart from that, if we're looking towards events, by the time this episode is out, 2 Feet and a Heartbeat would have taken place. And as usual, the event will surely be tremendous, and it will be such a fantastic demonstration and an honouring of the lives that are lost to COHD. There's lots of new locations this year as well. So we've expanded a little bit and some new locations to capture some more people, which is wonderful. And then there's also Race to Remember, which is coming up. And this is sort of a new initiative.
Yeah, that's really new. Tell me more.
Yeah, so this last year, I believe we called it Heartbeats, and it's a bit of an exercise initiative. So you can sign up to Race to Remember. You can dedicate the time that you're going to take a certain amount of steps, and through this, you can ask for people to sponsor you, but you're also raising awareness about COHD and contributing towards the community with fundraising. But we also have ambassadors signed up to this. So we have some sports stars. We've got some people working with Super Cheap Auto with cars, and they're contributing as well and committing to a certain amount of steps, and participants can race against them essentially. So it's a bit of extra fun with that too.
That is anything to sort of keep us motivated, keep us fit, healthy, but there's nothing wrong with a little bit of competition online.
Exactly. A little healthy online competition never hurt anyone. And speaking of online as well, we had a new website that was launched this year, which is absolutely fantastic. And that was a very big project that had a lot of co-design from people in the COHD community, really finding ways to design the information so it's really accessible and logical to find things. And I think one of the coolest things in the website is our resource library as well. So if you go to the website, you can head to the resource library and you can search for the fact sheets, videos that have been created. Episodes of the podcast are also listed in there. And it's such a fantastic place to explore, because we do very much focus on developing these resources for lots of cohorts through their life journey. So it's not just for parents and carers. We've got things in there for teens, for adults, extended family, and we also have lots of our resources that are translated too, which is fantastic. So we can support as many people as possible as they would need it to. So the resource library is a really fantastic initiative, and I'm so happy with how the website looks, and I think a lot of people are really happy with how it works too. So that's fantastic.
Well done. Well done to you and the team. I know you've been instrumental in putting those resource fact sheets together. I know it's not an easy job, because like you said, you've got to think about this has actually got to cater for everyone in our community, people on different journeys at different stages, and also to different types of diagnoses. So, well done to you and the team. Like it's no easy feat to pull together a really dynamic website, but that's really informative as well. So congratulations.
Thank you, Sami. I couldn't really take much of the credit for it, just by chipping in every now and again, but the staff on our team are absolute experts at putting these things together. And of course, we're touching base with experts in the community, healthcare professionals, and lived experience too. So we're really getting a very holistic approach to developing the resources so they're appropriate and they're applicable as well, which is really important.
Indeed. It's got to be practical, doesn't it?
Absolutely.
Okay, great. So anything else happening in the digital landscape that we need to tell our listeners about?
Yeah, so I guess at the time of this recording, not much will be known just yet, but in the coming weeks, and it may already be released by the time this comes out, we do have a new digital initiative starting, and this will be called HeartKids Connect. And
wow.
Connect is going to be, it's really exciting. It's going to be this digital forum, essentially, for people that they can log into this space. We have dedicated forums for different cohorts as well. So people can step into this space, sign up, and actually engage with other teens, other adults with COHD, with other parents. They can ask specific questions, they can share knowledge, and they can really have this beautiful, safe and secure, but dedicated space for these conversations. And it's also nice that it's sort of away from some of the noise and the chatter of social media. It also gives us the opportunity to capture the people that don't use social media too. So this is still, being workshopped, and we'll have a soft launch soon, but it's going to be a really fantastic place for people to connect and really feel seen and heard for their needs.
Yeah. And obviously it sounds like it's going to evolve like everything. It's great that you're putting it out there. You're trying to connect with those different audiences, like you said, that don't use other platforms. And all those things are always a work in progress, aren't they? Because usually the audience starts to dictate what they need and how things should obviously play out. So that's great that you guys are doing, it's phenomenal. The year is crazy. I can't believe we're in September And and by the time this is released, gosh knows what time of the year it will be, but we'll be definitely wrapping up the year. So it's phenomenal to hear all the wonderful things that you guys have all been doing. And I know, Mel, that you don't want to take full credit, but I am going to give you credit where credit's due, but also to the entire HeartKids team. Obviously, I understand it still includes volunteers. It includes, everyone who has some sort of input, whether they be specialists or different people from different walks of life. So, yeah, I can tell you the community is incredibly thankful.
Oh, thank you, Sami. That's so wonderful and very kind of you. I think this has just been such a busy year, and I must obviously, of course, shout out to the incredible support work that is being done in children's hospitals, in clinics, in the community, just the tireless efforts of our staff really to support people on the ground and just be that little pathfinder for them on their journey for how they might need information. The organisation is just really taking wonderful strides in supporting the community.
Yeah, that's great. That's great, Mel.
So, Sami, how has your year been? It's been a big one.
It has indeed. So the year, how's it been? It's a big question, but it's been really busy, Mel. It's been busy. Obviously, as you know, I've got 3 kids. Both my husband and I work full time. But I do actually want to sort of talk to that piece and say that it's definitely, as we hear from many people within our community, is it's not a straightforward journey. Sometimes it feels like it's, 2 steps forward, 5 back, and everything else. However whatever saying you want to apply to how crazy life is raising a child or children with complex health. So I suppose I just want to put into perspective is that this year's been busy and I've had the opportunity to work full time for the first time in many years. So that's been incredibly exciting for me, but it hasn't come without a whole heap of pre-planning to make that happen. So last year I dropped right back into probably first gear and really just concentrated and honed in on Frank's needs. And that was really looking at things holistically, like really addressing everything, obviously with his health, his disability, and also to the therapies that he was requiring for that next chapter in life. So Frank turned 10 in January. So with that, it's that we're going into that next phase, Mel. So, there's that early intervention piece, which I know you know very well because you've worked in that space before this as well. So it was really about just getting right back down to the grassroots and spending a lot of time with NDIS as well. So we had to sort of raise Frank into the complex care space just so that we could advocate for the right funding and therapies that he actually truly needed, as opposed to a bit of a cookie cutter approach that can sometimes happen with the NDIS. And I'm sure there's many people listening. So to put into perspective too, I have to put into perspective that Frank was born with an AVSD and had a repair, but he also has a vision impairment. He has epilepsy and an intellectual disability. So he's quite complex. So that's also too why he's on NDIS. He's not just on NDIS but for being a heart kid. So it was a lot of hard work, and it meant putting a lot of things in place so that we could both work full time. So I feel blessed, but also too blessed that everything came together. But it was a solid 6 months of hard work to get us to this point. So it was definitely not something that just kind of happened overnight. And it's something that we continually have to reassess and see if things are working and how we can best support Frank through this as well.
Absolutely. It sounds like that's just such an incredible amount of work and so many different things to juggle all at the same time. And I imagine as well, we're also bringing in other informal supports to support you through this journey. I mean, such complex care and sorting all of these different bits and pieces out through the NDIS and managing lives too is just a huge thing to tackle. So it sounds like you've been doing a tremendous job. Well done.
Thanks, Mel. Thanks. Appreciate it.
And how's Frank doing at the moment?
Yeah, he's good. He's stable. So we're still on 6 monthly checkups and we'll continue to be probably for quite some time until we start to see Frank's heart starting to fail again. But so far so good. Obviously he's got a leaky valve and he's got a little bit of extra pressure in places that he shouldn't, in right ventricles and so forth. So I'm sure there's people listening that I'm not going to bore you with all the extra bits and pieces going on. But so far so good with that. So I can't really complain. And once again, just so thankful to have the care and the community around us and knowing that I too lean in on HeartKids. And like you said about those informal supports, For us, it looks very different. It looks, there's a carer involved, there's speech therapists, there's exercise physiology or EP. So, great that we have episodes even about these things too. So, yeah, so it's quite complex for us. So, but other than that, yeah, he's good. And we're in one of the luckiest countries, are we not, with some of the best health professionals, and any concerns, the team just jump. They just jump all over them. So incredibly grateful.
Absolutely. So I understand that you recently have had a new diagnosis for Gigi. How is this going? Would you like to share a little about this journey?
Yeah, that's right, Mel. So why have one heart kid when you can have two? So, obviously always learning. So so this year Gigi, my middle child, has been diagnosed with SVT, and basically how that all came about was she'd been sort of talking about at school, coming home and sort of saying, I had a stitch. I had a stitch at school today, or I was in the playground. And I suppose I just really took it on face value and just said, okay, well, yeah, you're a kid and you're running around and that happens. And maybe when you eat next time, like stop and let the food digest before you run off. But also too, understanding great that she's running around, and was thinking everything was kind of very sort of, well, I didn't think much of it at all, if I'm really honest, until actually the start of this year when she said, oh, Mum, I'm having one of those stitches again. And she came out into the kitchen and she was holding her heart. And that moment was, I'm not going to lie, Mel, it was hard. It was really, really hard because, she was holding her heart. She wasn't holding her lungs or diaphragm or anything lower. And so, of course, I think being in this world, I knew exactly when she was holding her heart, it was her heart. So that was really confronting for me. But also too, I was really mindful of not reacting in the moment because she was looking me straight in the eye. And so I just placed my hand on her heart and I could just feel it racing. It was just pounding out of her chest. And I know we can't swear on the podcast, but you could imagine it was a moment of just like, oh no, like this, like really? Number like two? Come on. So I suppose I just jumped straight into, well, I know what to do here in the respect of she's going to need to be seen by someone. And so I got on the phone to our GP straight away, explained the situation. Also too, gave context that Frank was also to a heart kid, because that's not always the case when you're speaking to obviously receptionists or so forth. They're just trying to triage the bookings and so forth. So I just wanted to give her that information straight up, and they were fantastic. Just swiftly got us in and just made sure that I kept talking calmly to Gigi. I know my eldest daughter, Coco, was going like, what's going on? I think her face kind of really said it all. And then, we got into the GP and they straight away hooked her up to an ECG. By that stage, her episode had passed. But knowing the family history, as in knowing that Frank was a heart kid, they said, great, let's not mess about. We need to get her in. And then that's where I was really fortunate because we're already in the system with Frank. I could reach out to cardiology at the Women's and Kids. Mel is on the reception there, just so you know. And I was like, hey, Mel, it's Sami G. This is what's going on. And, and this is what's happening now with Gigi. And so we were really fortunate. We got in to see one of the cardiologists fairly swiftly. So it was still a couple of weeks because let's face it, these guys are few and far between and there's a lot of us out there, but still incredibly swift in the scheme of things. So they believe she has SVT. So that's supraventricular tachycardia. Hence,
it's a big one.
I know, suprafragilalistic. No.
I can't get my mouth around it myself, and I must have to say it 100 times a week. So it's definitely, SVT is a very, very good acronym.
Isn't it? It just sums it up for us. So I'm still not completely across everything in the SVT space. All I know is there's quite a few sort of different levels and different types of SVT. So we're just starting to investigate that now. So I suppose for probably other people out there listening is we still had to go through all the same steps that you would. Do you know what I mean? She's had to have an ECG, an echo, obviously understanding if there was anything else going on at the time. Was there any other feelings of, faintness, dizziness? Did she feel nauseous? So you can imagine a full workup like you would any heart kid. So now the steps that we're taking is she's had an overnight heart monitor, and of course that didn't show anything. It's always the way. And then we've now done a 4-day heart monitor, and of course she took it off on a Saturday night, so she played footy in it and everything, and she had an episode Sunday morning.
Oh my goodness. The way, isn't it? Oh,
it's dear. The way. But again, I know there'll be lots of people listening going, yes, that sounds about right. And that was the great thing, the cardiologists, expressed that the chances of kind of catching it, you have to try and catch it in the moment to get that really sort of granular, razor sharp diagnosis on actually what is happening and when and what's triggering and all those sorts of things. So yeah, our next step is I'm pretty sure she'll be wearing a heart monitor for a week. So in the meantime, we're just recording things whenever she has an episode, for how long, and just going through those steps of really, trying to weigh up what that sort of true diagnosis is.
Absolutely. Have you got any tips for any parents that might be listening about supporting a child wearing those Holter monitors? Because I've had to wear one myself, and I know that they're not comfortable and they might be hard to sort of navigate. And it's difficult to find the language to communicate that to little ones. Did you find that there was anything that really worked when you were supporting Gigi while she was wearing the monitor?
Yeah, good question, Mel. I think for G, in our case, because both girls have been around Frank through his journey, they were very sort of aware of kind of the terminology and language and everything that was going on. But this time it was around sort of explaining that what she had, I think because her thinking was, does this mean, I need open heart surgery? And it's like, no, this is a completely different type of heart condition you have, which is all around the electrics, let's call it. So instead of the plumbing, it's the electrical side of the heart. So for her was just probably more so explaining that and helping her to understand that it was nothing to be afraid of, and that yes, it was uncomfortable, but it was to get closer to a deeper understanding so that we could find all the words and could find all the language and help her understand. I think for her it was also going to school with it on was just sort of that kind of, are people going to see it? Because obviously a bit of the sticker was sticking above her school dress and all those sorts of things. So I think for her there was that next level, Mel, of probably I could articulate and help her understand it. It was now that piece which I suppose probably going into that preteen space where they're starting to feel more body conscious. So that was more the conversation we had to have, and to help her understand that it's okay. And a bit like yourself, I actually referenced a few people that have worn them. So again, to just demystify it, like she wasn't the first child, she wasn't going to be the last. And this was happening all day, every day, all around Adelaide and across Australia. Someone is wearing a heart monitor. Yeah.
I think that is fantastic advice to demystify it. I think that's absolutely brilliant because, as we know, COHD is so incredibly prevalent and it's everywhere all the time. And there's so many people out there that are having this experience right now. We just don't really see them. So that's brilliant advice. And I hope people can apply that to their own circumstances. That's great. So how about just in general, like any advice for parents in terms of like discovering a new diagnosis for a second heart kid? Do you feel like there's anything unique that you have as a perspective after supporting Frank and then receiving this new diagnosis that other people might benefit from knowing?
Yeah, I suppose like everything, Mel, I think it goes back to just trusting your instincts and really going with your gut. There was the moment, as I said, I can close my eyes a bit like I can close my eyes with Frank and see it all and take myself back to those moments where he's being in really quite critical conditions. With Gigi, for me, it's that kitchen. It's the kitchen and me placing, my hand on her heart and feeling it race like it did. I think the learning was, I suppose, for me was that I had been down this path before. So there was a bit of comfort. Like I must admit, the first thing, I think I went into shock for the first week, I'm not going to lie, because I did think, oh gosh, I'm not sure I can do this. Like, I'm not sure. You know, I've become an expert in Frank. I am an expert in AVSD and Frank. I'm not sure I have a capacity to be an expert in whatever is going on for Gigi. But like everything, we're amazing creatures, aren't we, as humans? We seem to just adapt and evolve. And once I sort of shook out of that, I just kind of thought, well, I'm in the best place. And I just kept reminding myself, I've got the best care. I know exactly who the cardiologist is. I think it would be probably a lot more difficult if this was something else, like it wasn't heart related. It was lung or neurological, or do you know what I mean? If it was another organ, like if all of a sudden I had to learn about the liver, I think I'd be like, oh, no. I'm much more comfortable knowing about the heart. So I think, again, following those instincts, understanding that I didn't have to have all the answers, but I knew the path and I knew all the resources. I think that's the other thing too, Mel, if I'm really honest. And, you know, it's great to get that snapshot from you at the start of this episode around what's happening in that space. You know, I have to go back to when Frank was diagnosed. We weren't a national body. There wasn't that website. They weren't those resources. The resources were, you know, looking online for different health resources from different hospitals around the world. And so a lot of it didn't relate, or the statistics were relating to a population of America or, you know, the UK or whatever else. So I think that's the other thing I did take away is, gosh, like we're in a really good space. We're in a really good space. We know where to lean in. And, you know, I think it was GP, it was then getting that referral, calling the hospital saying, you know, can we get Gigi in? So now I sort of joke that I have a 2-for-1. So basically Frank and Gigi now have checkups at the same time. So that's kind of great. It's funny. It's funny for them. Frank doesn't like it because I think he's had the cardiologist all to himself for the last 10 years. So there's another piece going on there. But yeah, so I think I knew where to lean in. And then I think the third phone call I made was to HeartKids because I just had to talk. And I had just had to talk. Yeah, I picked up the phone to Tanya, who's our state manager here. Well, sorry, she's the National Programs of Support. Sorry if I've got a title wrong, but do you want to correct me? What's the title?
Well, I actually believe it's just been adjusted again, but for the sake of me trying to get this the most correct, the National Support Program Manager. So she's our senior leadership team member that has the oversight of all the big support stuff.
Yeah, there you go. So that was my third phone call. My third phone call was to Tanya. I just had to verbalize it. I had to say it out loud, and she was there. And once again, obviously, Leslie was still the acting CEO. I think I got a phone call from Leslie, I think later that afternoon. Like bang, the community was wrapping their arms around me, the family. And once again, can't be more grateful. But yeah, scary though in the moment, not going to lie.
Every time. Absolutely. And I think you've highlighted some interesting things there as well. We know that, CHD, like congenital conditions, we know there's so many variations of that. And then onset conditions, particularly things that are like electric or rhythm related, come on in a different way. And while COHD sort of is that nice big umbrella term, there's still so many different things that are happening in that space. So you speak HeartKid very well, but it's almost like with SVT, it's like a new dialect that you also get to acquire. You sort of, you get this extra bit that you get to add on to all that information and all that incredible knowledge that you've acquired in supporting Frank, and still a huge job. So it seems like it's been a very big, busy year for you, and just tremendous the way that you've been able to access support and find that comfort with the community around you as well. And that's what HeartKids is all about, really.
It is indeed, Mel, and well said, because it is. It's learning a new language, but yeah, to have the community, but even just have to have the podcast. This is the thing, that the knowledge.
If you're listening to a family's experience, a parent's experience, an adult's experience, you're still going to have so much value in sharing that knowledge and understanding these different journeys. And that's what it's all for, really, is just really immersing yourself in that if that's the path that you choose. So yeah, wonderful. Well, thank you so much for sharing these very, very big life updates with me tonight, Sami. It's been great to have the catch up and get to hear all the things that are happening with Frank and Gigi and Sami. So thank you so much for sharing that with me tonight.
Pleasure, Mel. It's lovely to sort of, I suppose, strip away our headphones and microphones and actually have this catch up, just you and I, and talk about our worlds, because we're still very much living in it, even though obviously I'm sitting here as a host. Tonight, obviously, I'm the guest. But yeah, it just shows that we live it every day, but there's a wonderful community out there for us.
Absolutely. Thanks so much, Sami.
Thanks, Mel. Sometimes this podcast talks about some heavy things. If this brings up anything for you or someone you love, it is important to reach out for support. The HeartKids helpline provides support and guidance for anyone impacted by CHD. You can call the helpline on 1800 432 785. To access more information about CHD, as well as support from HeartKids, visit the website at heartkids.org.au. The information on this podcast is not a substitute for medical advice from your doctor or healthcare team. Always talk to your doctor about matters that affect you or your family's health.